everyone. Welcome back to the Dr. Jones Optimization Academy, where I get to interview some of my favorite innovators in health, fitness, medicine, and beyond. And today we are extrememely pleased and honored to have Dr. Elizabeth Yurth. I need to get one of those soundtracks where I get audience cheering. This is where the audience cheers right here. Yay, right. And so for those that don't know or have not seen Dr. Yurth's work, she's all over YouTube and podcasts. So I'm very happy to have her make time for this today. Dr. Yurth is the co-founder and medical director of Boulder Longevity Institute. And I'm assuming that's in Boulder, Colorado, where she has been providing tomorrow's medicine today. And that's cool. I want to say that again. So cool. Providing tomorrow's medicine today to our clients since 2006. Dr. Yurth has completed advanced training in longevity, epigenetics, nutrition, hormone replacement, peptide therapy, and orthopedic procedures. So we are excited to have you here today and fair again.
Thank you, Greg. I'm glad you didn't read the whole bio, so we would have been here for an hour.
We lost you. There's no sound.
You lost me?
I can't. Can you hear me?
I can hear you, yeah.
I can't hear you. Check and see if you got some muting going on.
Okay. Yes.
Okay.
Microphone shut off. I stopped talking for too long.
No worries. Okay. So this is where the editing comes in. So I'm going to take a little pause. Okay. Welcome to the show, Dr. Yurth. Are we going to go by Dr. Yurth or Elizabeth or what's good for you?
Just call me Betsy.
Betsy. All right. I'm going to go back and forth between Betsy and Dr. Yurth. So just be ready for that.
You got it.
Welcome to the show.
Thank you, Greg.
All right. So looking at your bio, looks like you got started in orthopedics and regenerative medicine, sports medicine. How did you get from there to what you do today?
So yeah, that's tough because very few orthopedists think in a fashion that corresponds with what we do in more of, functional or regenerative medicine. And so basically I started doing orthopedics 30 years ago. And about, 17 years ago now, I got very, very frustrated. So halfway into my career, I was like, geez, all I ever do is kind of patch somebody together and they kind of get better. And then they come back and, really aren't better. So like injuries sort of got better. I mean, if you break your leg, it gets better, but most injuries just kind of got a little bit better. And then they would come back and aggravate people again. And you'd stick steroids into somebody and you do surgery on them. And it really was never restoring their health. So I started to explore, how could I make people healthy instead of just patching together things and sticking steroids and things? And so that came down to understanding more about genetics, nutrition, how hormones play a role in that, right? Why do we get worse as we get older? Why do you not see 18-year-olds and they get better and yet 40-year-olds don't get better or 50-year-olds? So I started learning more about hormones and nutrients and how we could make people healthier and that would actually make them better. And that took me to getting another fellowship from the American Academy of Anti-Aging Medicine, regenerative medicine. And then I really tried to actually sort of do both practices. So I'd see these patients and I'd talk to them about how their knee arthritis is actually related to their hormones and their health and all these other things. And you realize that you couldn't do that in these 10-minute orthopedic appointments very well. It was a little bit like, okay, well, I have all these things I'd love to tell you, but I just can't. So we'll just stick steroids in your knee. So it became increasingly frustrating. So about now 16 years ago, we opened Boulder Longevity Institute. And actually I did both practices. So I kind of had one hat I'd wear and during the day I'd see these patients and I would do things that I oftentimes sort of ethically probably didn't even agree with, but they sort of fit with a conventional medical practice where you're sticking a steroid in a knee and, recommending surgery and that's PT and that's about it. I would try and combine a little bit of knowledge in there. But we then had Boulder Longevity Institute where I would come in the evenings and on Fridays and I would see patients here where I felt like, okay, I can make you healthy here. I can spend an hour with you. I can sit down. We can talk about all the things we need to do. So I did that actually for, that sort of two-hat practice for a long time. And then actually just last February, so this year, I said, okay, I can't do this anymore. It's ethically, I can't sit there and see people in 10 minutes and think of all these cool things I could do for them. And I didn't even have time. So we just brought all the orthopedics to Boulder Longevity. And now Boulder Longevity has a lot of orthopedic patients. It's not, so we have, people who are just here for optimizing health. And then we have a lot of patients who come to me because their knees and their hips and their back hurt. We kind of, I think, you price this, we sort of separate when we're looking at the kind of medicine that we do, the kind of regenerative medicine we do. People don't think about orthopedics in that realm, right? They don't think about orthopedics. They still go to, they don't come to you because their knee hurts, right? They still go to their orthopedic doctor, unfortunately. And unfortunately, the orthopedic wear and tear issues are not wear and tear. They're inflammatory diseases. And they're no different than your heart and your brain. I always tell people, I go, why do you think that, your knees wear out? Because you use them too much, but your brain, you use your brain too much. Does it wear out? You use your heart too much. Does it wear out? So just like your heart wearing out and your brain wearing out, which are diseases of aging, arthritis is also a disease of aging. It's not a wear and tear disease. You can have very, very healthy people who have no arthritis, who have played football and so the key is we have to address joint pain in the same way we address all these other issues. So that's what kind of got me into this role of sort of trying to help people understand that you come to us for everything, including your joints. I would like people to see you because their knee hurts, not go to their orthopedic doctor because their knee hurts, because you're going to offer them a whole lot more than the orthopedic doctor is going to be. So if we can start educating that realm, we start bringing those people into understanding that their joint pain is the same as their brain wearing out or their gut not being good. So that's kind of what got me to what I'm doing now, which is a combination of sort of orthopedics and what we call regenerative or health-focused medicine.
That's amazing. And everything you said made me think about how my path got me here, because when I got out of school, out of naturopathic medical school, my focus was on orthopedic injections. I wanted to do PRP and prolotherapy and, back when you can say stem cell, that's what I wanted to do. That was it. I just want to inject people, get them better, see you later, wham, bam, thank you, ma'am. That was my whole process. But something I quickly learned is that there were almost two categories of patients with that. I would have the patients who would be healthy, active, clean diet, low inflammation, hormones balanced. You inject them, you'll never see them again because they got better.
They're good, right?
And then I had another category of patient that were obese or, drank a lot of alcohol, or they were smokers or ex-smokers who, still kind of in that range there. They had all this cellular imbalance, and you can inject them till the cows come home. They may get 10% better. It's a series. It just wouldn't get better. And so it made me step back and say, what am I missing here? And so I actually kind of went back to the foundational stuff and said, okay, your knee hurts. Great. Let's get some blood work. Wow, look at your CRP.
Right.
Look at your ESR. Oh my God, look at your HbA1c. Look at your cortisol. Address all these things. And sometimes you get all that fixed and it's like, you know what, doc?
They don't need that, right? They don't need the expensive regenerative procedure. I mean, I agree with you. It's like, it's much easier to just do these injections, right? But it's declined my practice of doing stem cells and things like that dramatically, because so many people get better just when you get them healthy. They're like, I actually don't need you to do the big expensive procedure we had planned because I actually feel darn good.
Yeah. And you know what? That becomes not only a patient for life, that's an advocate. Because now this person, they have a story to tell about, hey, I thought I was going to need this injection or the surgery, and we just got we got healthy and now I'm better. And that's probably no brainer. I mean, it's still fun. I still love the injections.
I agree. The procedures are fun. They're fun. They're simple. They're, but they're in and of themselves, they're not going to be the end all be all to getting people well.
Exactly. And so that's foundational stuff. And so that allows us to transition to why we're here. And so let me tell you everyone a story here. So I'm at the Peptide World Congress and Dr. Yurth is on stage talking, and I was sitting next to one of my colleagues. She's like, man, she's jacked, right? And I was like, yeah, you know what? She is kind of jacked, right? And so, and I remember I just couldn't get a chance to talk to you during the conference because everyone's trying to talk to. Everyone wants to talk to Betsy, because that's who you are. And so I finally get a hold of you and I'm like, hey, I think I asked you a question about Abutamorin and said it was a great talk. And then I think you said something. I was like, you're in great shape, by the way. And you're like, you are too. And I was like, guess what? You are now a guest on my show. You have flattered me. You're giving me a compliment. You're now my best friend. We hang out together, all that good stuff. So I was excited to have you here. But then when you told your story, and I'm going to let you introduce this into number one, how many kids you have, and then your age. And I was like, this is going to be a great talk, because I think there is a misconception on when females get older that the emphasis on being strong, on being fit, and being functional lowers. And so that's where I want to kind of start this conversation is first of all, I want to hear how old you are, if you don't mind. You should be proud of it because you look amazing and you're doing great with this. And it's all the things we do, but also the importance of maintaining that strength and mobility as females get older. So that's where we're going to start this off at.
So, I mean, you're right on. I'm 95 and look pretty good, don't I?
I know. So we should all aspire.
No, I am 60. I have 5 kids. They range age from 15 to 25. So, so sympathize with all you women who, it's a tough life, right? Trying to work and have kids and everything that we do. And I think sometimes for so long, we do put ourselves kind of in the back seat for a long time. And, the unfortunate thing from that is also when you turn around, you're like, Jesus, I've really lost my muscle. I've lost everything. And it's so important. And I really can't emphasize the importance enough of really starting kind of early, not just waiting until all of a sudden you turn around when you're 60 and go, oh God, I better get in shape, right? Is to start thinking about these things, even at a very young age. And, it's funny because my entire office now is sort of, I'm surrounded by young people. And by far now, as you get older, all of a sudden you're like, wow, I'm the oldest person around, where, you still always think of yourself as being you just you don't see yourself get old. Watching your kids age always makes you realize you're aging, but otherwise you don't. So, I'm surrounded by these young people, and it's kind of interesting that we've been trying to emphasize the importance of people understanding this stuff in their 20s, right? I sort of feel like my kids have a huge advantage because they're starting to implement the things I didn't learn until I was 50. They're starting to implement them now in their lives in their 20s, and that's going to make a huge difference in their aging. So it's not really like this is a talk that we should focus on everybody over 40, because people need to start thinking of this stuff. And, for your younger listeners, you need to start understanding this stuff at a young age. And there's a lot that we can get into in talking about things that are impacting even your younger women in terms of muscle building, like birth control pills, which horribly impact muscle building. And yet, what percentage of women are taking birth control pills and don't have any understanding of that? So, so I think, yes, we need to focus on this as we age, but we also need to think about it even in the younger population, because the key is that the earlier you can get started on this stuff and prevent decline, the better off you're going to be. We can certainly reverse things, as you know, right? We can reverse time, we can get back, but it's a lot easier if we just maintain from our young ages. Yeah. So that's kind of a key point, is to start thinking about this stuff as early as you can, and as I mean, we don't, when I was younger, I didn't, you think you're going to be invincible and live forever and be fine. And then all of a sudden you realize, wow, I get hurt. It's not so great. And so you start being a little bit more aware of how you have to take care of yourself. I don't know if and I don't know if you're seeing younger people coming into your practice. I don't know.
We actually are. And a lot of it is, it goes back to wanting to lose weight, but it's not so much wanting to lose weight. It goes back to something you said about getting older and you change, because one of the key complaints is, hey, I'm working out, I'm eating healthy, scale's not moving. I'm actually gaining weight or gaining fat, and I'm doing all the things I used to do when I was 20. And so that's where this conversation gets fun. It gets very fun, because now you're like, okay, yes, I still want you working out, eating healthy, but there's something else we need to dig deeper in. And this is where the hormones, for the most part, a lot of times, it's hormone and stress, is et cetera, et cetera. We're going to talk more about the stuff here. But the big thing is, you hit it right on the head, is like, you start early, it makes it better as you get older. Right. So getting those cells optimized, getting that function improved, because now when you get into those 56, you're already set up for success.
Right.
You're already kind of there. So, and that's the whole thing. And I think we talk about why the importance of it is longevity, is healthy longevity, and so that's why, for me, this is an exciting talk, because we're going to get into it, because if we can start thinking about strength and functional mobility when we're younger, aging becomes better. And that's the big key of that. So one of the things we mentioned, and we've kind of danced around a little bit, is the changes that happen in strength and endurance when menopause gets. So that's kind of the next topic of it here, is for those that, for the women out there who are going through menopause or perimenopausal, love to talk about how they can kind of recognize some of the symptoms and start how that impacts their strength and functional ability as they get older.
So let's sort of back up and first of all talk about, like, why do we need strength, right? Why do we need to be strong? Why do we need muscle? And then talk about, well, okay, if I'm going to tell you just go to the gym and work out, you have to have hormones in order to build that muscle, So if you have zero hormones and I tell you, you've got to just go to the gym and you got to lift weights and you got to be strong, you're going to try and get to the gym and not be able to do anything. So let's talk about why muscles are so critical, because this is a really cool stuff. And it's actually pretty novel because we didn't actually know anything about this even a few years ago. This is all really new research, but we now know that muscles, we used to just sort of think, okay, yeah, muscles protect your bones, right? And you don't fall down because you're stronger and you can, lift up the laundry basket without hurting your back. But we actually know it goes a lot deeper than that now, because now we actually know that muscles actually are what we call an endocrine organ. So just like your uterus or your testicles are endocrine organs, so is your muscle. And muscles actually produce something called myokines. So basically, myokines are proteins and proteoglycans that our muscles produce when they contract. So when we exercise our muscles, when we contract our muscles, the muscles actually release these proteins that actually have really far-reaching effects. So they don't just work on the muscle, they have all of these other effects. And we've now identified a slew of myokines. There's a ton of them, and they all have very important factors. So these are in this great, so Dr. Jones must have been, so we didn't even talk ahead of time, and he got this graphic. So this is perfect because you can see that these are just a few of the myokines that are produced when you contract a muscle. And they're really critical, right? That, these are all things, for instance, irisin, the one you see up in the upper left corner there. Irisin not only helps the muscles hypertrophy and get bigger, it also has far-reaching effects for joint cartilage. So we've now actually linked that higher levels of irisin, those people get much less chondrocyte damage to cartilage in their joints. So when you exercise and irisin levels go up, it goes to the joints and it tells the chondrocytes to reproduce and get stronger. And so people who exercise actually have less arthritis. And yet what do we do when people start having arthritis? We tell them, oh, you just should, stop putting so much load on your joints. You should stop walking. You should stop exercising. So now what happens? Now they're not producing irisin. The irisin doesn't protect the joints and they get worse and worse and worse. And we're like, well, okay, now you can have your joint replacement. Good. So that's a really key one, and then look at myostatin. So what does myostatin do? Myostatin basically stops muscle growth, right? So we don't want to have myostatin levels, so actually what happens is myostatin levels actually, when you exercise, go down. And so you actually suppress myostatin with exercise and you get more muscle mass. And then, and then there's brain-derived neurotrophic factors. So BDNF that you see up in the upper right-hand corner, basically BDNF, what's that important for? Your brain. Higher levels of BDNF, less dementia. So that's why, much better than the recently released Alzheimer's drug for dementia is exercise for dementia. In fact, the study showed when that drug got released, well, exercise worked dramatically better than the new Alzheimer's drug that got, questionably legitimate approval. And yet we don't get our old people exercising. In fact, if you look at old people exercise class, they're doing like ankle puffs in their chairs, and then maybe you get them walking, but that's not huge muscle contractility. You have to load their muscles. So you've got to take these old people and load their muscles, which is sort of counter to what we do, right? We have the chair exercise classes, and and granted, do what you can do, but if we didn't let these people get to that point in the first place, they'd be a whole lot better off. So IL-6 is an interesting one, right? Because IL-6 we actually think is an inflammatory protein. Exactly. And so why do we want upregulation of IL-6? Well, it's interesting because IL-6, one of the things that they saw in a study was they saw that when you exercise, it actually pulled IL-6 out of circulation into the muscles where the muscles need it, because you want the muscle damage to occur when you lift weights, right? Because then the repair is what gets you bigger and muscle hypertrophy. So what they found is you actually took IL-6 out of where it can do bad things, like create chronic inflammation in your body, and actually to where you want some active inflammation at the time, which is in the muscle itself. So that high regulation of interleukin-6 in the muscle actually seemed to be or beneficial to the muscle, and beneficial because you took it out of circulation. So really, honestly, really cool stuff. And they've identified now, I think about, 100 different myokines that are produced. So as soon as you stop exercising, look at all the organ systems that you've screwed up. These growth factors, FGF21. We're going to talk later about mitochondria, and mitochondria are they're the powerhouses of your cells, right? It's the one thing you remember from high school. And it basically, if you are just doing your chair exercises, then you're not going to have this mitochondrial biogenesis. So do not sort of put, okay, I'm just going to go for my walks every day. That's great. If it's all you can do, it's all you can do. And there is myokines released even when we do aerobic exercise as well. It's interesting. There's different myokines released with aerobic exercise and anaerobic exercise. They're both important, but I'll argue that you've got to get the muscle load in to get the major benefits.
And I'm so glad you brought that up about IL-6 and about, I don't know if we talked about decorin at all, but definitely IL-6, because we're taught even from med school that IL-6 is a bad thing.
Right.
It's one of your, we talk about tumor necrosis factor alpha and IL-6. We're like, oh my God, these are bad. We want to suppress these. We want these down, right? And in many cases, systemically, yes, but for the muscle, like you brought up, and I was reading that in a research paper too, about it being drawn in and actually causing that growth, because this kind of goes back to the whole, when we talk about antioxidants, and overdoing it on antioxidants as athletes can be a bad thing, because you can't grow without that change, without that process.
Right. You need some inflammation. You need some oxidative stress to your muscles. That's why you don't want to take your antioxidants shortly after exercise, because you've just negated that oxidative stress that will help your muscles grow. So those of you who go exercise and then you pound your resveratrol have just negated a lot of the effect of your exercise by doing that. So, so that's where IL-6 inflammation, oxidative stress for our muscles after we exercise them is a good thing. That's what tells them to get bigger and stronger, right?
Exactly. So this is probably going to be the coolest part of the first half or first part of our interview, because we very much went through, okay, this is important, but we know that's kind of, obviously people are listening to this, they know it's important, why it's important and all that good stuff here. But what I want to kind of talk about here for the end of it is, and in my little notes, I put how to create an undefeatable foundation. So a foundation of strength and health that is undefeatable, because you did part one, which is the strength training. We did part one, which is the strength training and the importance of muscle and muscle contraction. But let's kind of talk through some of those 10 poles of the foundation on being functional and fit as we get older. So, I know you mentioned mitochondria. There's a ton of these things, but I love to get like your overview on these.
I think it does. When you start out with basics, it's funny. We put together this course because what prompted some of this was we actually, with all these people who listen to all of these podcasts and Instagrams, and they literally came in with their Venn diagrams of the things they were doing. They were doing their sauna, and they were doing their cold, plunging, and they were taking literally 800 supplements. And yet they had neglected some of the very basic stuff. And so we actually put together this course called What to Fix First to say, hey, this is where you have to start. Peptides are really cool, right? They are really cool, and they're jazzy and fun, and you can do a lot with them. And, doing your cryofusion is great. But if you have no hormones, none of that is going to really have much advantage to you, right? Now, will you improve hormones a little bit by doing some of that? Yes. But as you get older, you really probably need to start with replacing the hormones. So we kind of started with, you've got to get the nutrients and the hormones in line first. And almost every hormone drops as we age, testosterone, estrogens, thyroid, all of those things. It's not really just the progesterone, estrogen, and testosterone. So all of them drop, and they all have to be kind of balanced. So you can't neglect one for the other. You have to make sure that the thyroid's normal, the cortisol is normal, all of the steroid hormones are normal in order for somebody to actually go and build muscle, right? So I'm saying go to the gym, build muscle. So if you're a woman who is, so let's take, because I have a lot of even, you've got 40-year-olds still on birth control pills, right? Because they don't want to get pregnant at 40 and they're still cycling. And, one of the things that birth control pills do, and this is really important for your younger listeners, your younger women, is they markedly increase what's called sex hormone binding globulin. So you have these super high levels of a protein that binds all of your testosterone. So now you have zero testosterone. So you've got pretty high levels of estrogen because you're on the pill, so it's replacing estrogens, but you have zero levels of testosterone, and so you're not going to be able to build muscle because all the testosterone you're making is being bound away. It's not utilizable. And so a lot of younger women who are struggling with that weight gain and things like that, 20s, 30s, 40s, doesn't matter. You've got to either say get off the birth control pills or supplement them with some testosterone as well, because you've got to upregulate the testosterone. And that can go on for sometimes a year or two after the birth control pills are stopped, that the sex hormone binding globulin will be elevated. I think we give a lot of credit to testosterone for muscle building. And obviously it's the most anabolic of the hormones. It's why you're giant, and I'm not ever going to have muscles like you. Right. So, but the key is it's important, it's hugely important for women at about a tenth of, we make about a tenth of the production of men, but we have to have it for anabolism, for building muscle. Right. And it gets really, even docs who replace hormones forget that women need testosterone. I see so many women coming in who their doc actually gave them some estrogen, put them on an esterase patch, but no testosterone. And they're like, hey, I'm fat and I can't build muscle. And, and so you have to get testosterone optimized in women. And it's a key player. Honestly, testosterone goes such a long way in women for just making them feel better. They have better sex drive. They have, less anxiety. They have, they're kind of more stable. So, so I think that that's a place where it gets really neglected, that where women really get kind of, shoved by the wayside. And that once you get older, you don't need testosterone. Right. And then I think the other piece is that one of the things that happens as you start to get in that menopausal or perimenopause, so this actually starts pretty young, like in your 30s, you start to become very estrogen dominant. So there's some goods to that in a sense for muscle building, because estrogen is actually pro muscle building. But what happens is estrogen, and this is true when people are on birth control pills too, estrogen makes our ligaments much more lax, much more pliable. And so when you get into that really estrogen dominant state, you're much more likely to have injuries. So now I got your testosterone back on board, right? And yet your estrogen is, you've got all this estrogen. And so now you tear your ACL skiing. And so, it's funny, I've torn my ACLs 5 times. I haven't fixed them the last times. I just wear braces, but it was when I was younger, and on birth control pills. And then I was skiing when I was pregnant, which was probably a bad idea in hindsight, tore my ACL. So you see these high levels of estrogen set us up for injuries. Same thing happens when you're 35 and your estrogen levels are dramatically high, or 50 and your estrogen levels are dramatically high. So we have to think about how the hormones are protecting us from injury, not just from muscle building. So, you've got to have all of these things balanced. Progesterone has to be balanced as well. So you've got to have the estrogen and progesterone balance for tendon structure, for ligament structure. You have to have the testosterone balance. You have to have all of these things optimized, the thyroid, the cortisol. Otherwise, it's sort of, sending you to the gym and saying, go work out. It becomes a little bit difficult, and then you guys get frustrated with Dr. Jones and I, because you're like, well, I'm still fat and you told me to go exercise and I'm not any better. That's because if you didn't have your hormones on board. And so you probably see this all the time, right? Doctors send people off and say, you just got to go exercise. You got to go exercise. And they come see us and you're like, yeah, you're not going to be able to do anything until we get your hormones in order. Right.
It's so important. Now, kind of circling back to the birth control, is that one of the things that I've been reading about, and once I read this, it changed the way I implement some of my peptide protocols, is that oral estrogen actually impairs the metabolism of growth hormone in the liver. So it drops IGF-1 production.
Right.
And
quite dramatically, actually.
Exactly. So in the beginning, I was like, oh, you're in birth control. Here's some CJC 1295 Morel. And I'm like, this isn't doing anything.
Right.
And that's when I circled back and realized it's the birth control. It's literally blocking growth hormones action on the liver. So you can't produce IGF-1.
Can't produce IGF, right.
And that's it. I mean, that's game changer right
there.
Yeah.
It's huge. It's unfortunate because nobody wants unwanted pregnancies. Birth control pills are certainly, I have a niece who's a nurse midwife who works in a very poverty-stricken area. She says, I'm not going to take any of my women off birth control pills. That's, but there's a lot of bad things. And that's one of them, that you're suppressing growth hormone, you're suppressing testosterone. You've got these high levels of circulating estrogens. They don't have any progesterone. So sometimes your progesterone levels drop. And so, it's certainly better to be, probably the safest birth control method is to use like a copper IUD, something that's actually not going to have any kind of hormone events. But I know women don't like that as well. So then we have to sort of try, if we can't get women off the birth control pills, how do we deal with the consequences? And there's ways we can do it, right? So there's things you can do, but it's tough.
So, and this is so cool that you said that, because I have this diagram I draw for my new patients where for the most part, we know there's the 9 kind of principles of, the nine, what is it? I'm drawing the biggest blank right now. 9 hallmarks of aging.
Yeah.
And so I don't go over all 9. I've kind of broke those down into 6 or 7. And, decreasing hormones, and we talk about cell repair, cell function, mitochondrial health, inflammation, oxidation, autophagy, and senescence, all that. But the beginning of that is the foundational stuff. And then that's the whole, like, what are you eating?
Right.
Are you eating dairy, et cetera? Are you sleeping? Are you stressed? What are your, not only what's your profession, what are your personal relationships like? Is there a toxic component to your life? Because that's going to affect your health. And then we kind of draw that into the hormone piece. And then we get into, that's when it gets fancy. Because once we have a good foundation and we got hormones optimized, that's when you can take off. That's when the peptides can be the most effective. That's when the NAD can be most effective, and all your senolytic protocol. I have this retainer, it throws me off. And that's when all your senolytic protocols can be more effective as well.
Yeah, exactly. And don't you get everybody gigging out on that stuff, right? Because that's what all the podcasts and everything's like, oh, take, you need this cool peptide, or and none of that is going to have, it's expensive, and it's not going to have the benefits if you don't have the foundational health, which starts with, again, proper nutrition, proper sleep, reestablishing circadian rhythm. But hormones are going to be paramount to all of that. Like, even if I say how to, proper sleep, essential, right? We know it's critical. We know reestablishing a normal circadian rhythm is critical to our health. And yet, if you don't have your hormones in order, both women and men, sleep is very disturbed. And for me to just say, hey, go to bed at this time, get 8 hours of sleep, that's not going to work if you have zero progesterone, right? For both men and women, men need progesterone too. So it has to be really, that you've got to kind of start with fixing some of these very base hormones in people, oftentimes, for any of the other therapies that we do to work. And, I have so many people call me all the time and say, oh, I'm really interested in this really cool peptide for muscle growth. And I'm like, well, you might start with some hormones that are a lot cheaper.
Yeah, exactly. It's a big one. I was like, well, I mean, what are you eating? And start there.
Yeah, exactly.
Seriously, like, let's start there. Are you under eating? Are you overeating? And so are you?
But it's not as fun, right? That's just not as fun, right?
No, it's not. It's not as sexy. It's like, you're shooting yourself in the foot. And I'm one of those people. Like, as much as I love peptides, like, I will not until it's time. I just
right. They're icing on the cake. They're not the foundational piece.
Yeah, I even get to the point, where I have certain patients and we talk peptides, and I'm like, well, if you're not even working out, or you're like, hey, I'm too busy to work out, I'm not going to the gym, then you know what? Let's just wait, because I'm like, it's like you have a Ferrari in the garage, you're not even driving it, so like, why?
Right.
I want to make sure you're getting the best benefit of it. I don't just want to take your money, man. Like, get your foundation. And this is just my male patients, female patients too. It's like, hey, this is great, but it's motivating too. Yeah. It's like, hey, I've got this great thing that can get you even more optimized, but I don't even want to have the discussion with you until you kind of get your shit together. So that's really the foundations of it, so we go with it from there. So we've covered quite a bit here. I have my notes here. I'm big on that, hormones, and we talked about some stuff we haven't got to yet. And we get to that in part 2, with just like certain, mitochondrial health. I want to talk about that in part 2. NAD is important to this discussion as well. I want to talk a little bit about how autophagy and senescence are important to this conversation. And that's before we even get into some of the peptide talk here. So I'm excited to get this even further. So before we let you go for today, first things first, how can we find you?
Oh, my clinic is called Boulder Longevity Institute. So if you just go to BLI.com or BoulderLongevity.com, you can follow me on Facebook at Dr. Yurth, or you can follow Boulder Longevity as well, at Boulder Longevity. And we actually have a whole training arm that you guys can actually take courses. So that's kind of fun. It's, our thought is that we're talking about myokines, right? That myokines are not taught by your doctor, doesn't know anything about them, right? And so you guys need to learn them. So one of our goals is to make you guys become your doctor, because you're not going to get it from your medical profession. And, finding Dr. Jones and finding me is not that easy in the world. And so we want to train people so that you can actually spread the word. And so if you go to our BLI.academy, you can actually sign up for courses. Like we talked about, this What to Fix First course. It sort of walks you through, okay, do this, do this, do this. And then you can talk about these other things. So that's an option. So you guys can kind of train. So just go to BLI.academy, you can sign up, you can do courses. We have some live courses as well that, well, they've been sort of COVID deterred for a year or so now, but we'll hopefully get back to them if the world ever goes back to some normalcy. But yeah, I think that, I appreciate you guys listening to this stuff and learning it. And please, it's so important because you're not going to get this information from your traditional medical doctors. And they're, and unless we start changing this from your own understanding, your own perspective, and then searching for people that you can work with, nothing's going to change in health and longevity.
So true, so true. And for those that didn't catch all that, I will have Dr. Yurth's information and Boulder Longevity Institute, their website. All that will be in the show notes and the show liner, so you can look them up, get more information. So I want to thank you for spending time with us today. And this has been a fabulous discussion. I am super excited for part 2. So you guys are going to look out for that, and we'll talk to you all soon. And thank you again.